everyone, once again welcome to my Oet channel. Today we will see one among the exam role play card. This is related to dog bite and the wound care. So you can see the setting is emergency department and you have provided with some instruction that your patient is 20 years old librarian and has just had sutures in the department after receiving a serious dog bite on his or her right hand. You see him or her explain how to look after the wound. From here, it is clear that this is in the emergency department and already the sutures has been provided. And you are going to the patient to explain how to take care his or her hand or the wound. So, in this scenario, even if it is given has just had sutures, that means you are not the one sutured the wound. That means it's happened in the department. And now your role, you are approaching the patient. So in this scenario, it is not a known case, but the patient already got admitted there for these procedures and all. So you have the case now. That means you are aware the name of the patient and the condition, but you are not maybe or may not be already contacted with the patient. So what you have to do, you have to ask his name or her name before the presentation. That means during 3-minute preparation time. You can ask, how may I address you? So the answer will be maybe Mr. James. Okay. So how will be the introduction? The first task is confirm patient's wound treatment is complete. Explain your role, that is wound care instructions. Find out how patient is feeling. Find out what patient knows about wound care. So there are 4 subtasks. They have given 4 subtasks. How we can start? Good morning, Mr. James. I am Reshmi Rajan, one of the registered nurses working in this emergency department. I would like to tell you that your wound treatment is complete and my role is I would like to explain you regarding the wound care and the instructions what you can do at home. Is it okay for you? That answer would be yes. Then we can ask, before proceeding further, Mr. James, could you please tell me how you are feeling now? Do you have pain or any discomfort over the affected part? Then the answer will be, of course, sister, I have severe pain in that area. Then we can just give a reassurance. Well, Mr. James, I can truly understand that you have pain, but no need to worry with the course of treatment and these painkillers are included so that your pain can be relieved. And I would like to explain you regarding the wound care. Before that, may I know, do you have any knowledge regarding the wound care? The answer will be no. So the next task is give information about the wound care. Keep wound clean, gently dry and apply new dressing if wound gets wet. Find out about patient's job and if right or left-handed. So we can tell like this. Well, Mr. James, please take care your wound and keep your wound always clean and dry. You can apply new dressing if it gets wet. Are you getting my point? Like that you can ask. And then one more question we have. Could you please tell me what's your job and you are left-handed or right-handed? The answer will be I am librarian and I am the right-handed. Then there actually we can give a suggestion. Okay, Mr. James, I can tell you that you are already right-handed and the injury got happened in the right hand. So please take care to prevent further injuries. Are you okay with that? Like that we can ask. And the next task is stress need for extra care with the hand in first few days. Example, aids healing, avoids opening, infecting wound, etc. Advice on possible sling use, example, reduction in swelling, better protection, awareness of affected area. So we can tell like this. Either you can ask, do you have any concern? The patient's answer will be, how I can take care my hand. So the answer will be, yes, of course, I can explain you with that. For first few days, please take extra care for your hand to aid your healing and to avoid the opening or to prevent further possible infections of the wound. Moreover, you can use a sling to reduce the swelling over the area, and it is better protection also. It will help you to protect your arms, and it will prevent further injuries. So please take care your hand with the use of slings also. How does that sound? Like that you can ask. The next task is reassure patient about infection. Wound clean, course of antibiotic starter, tetanus up to date, and advice on signs of infection. They have given some examples: swelling, greased pain, feeling of heat, leakage of pus, then give details for removal of sutures, nurse in 7 days. So there are many tasks, subtasks they have given. Then we can tell, for your further information, I would give you some suggestions regarding the prevention of infection. Actually, your wound is now clean and we have started already antibiotics for you. Moreover, your tetanus vaccine is up to date, so no need to worry about any further infection. But in case if you see any signs of infection such as swelling, increased pain, feeling of heat, leakage of pus from the wound, please do not hesitate to contact with us early as possible. Are you getting my point? Like that we can ask, and we can ask another one more thing. Do you have any more concern? The possible question, wherever you can expect that possible question, there you can ask the patient, do you have any concern? Okay. So here the possible question will be, when I have to come back to the hospital for suture removal. Then we can tell that, yes, your question is reasonable, Mr. James. You can come back within 7 days for the suture removal. Then we can ask, do you have any more concern? Then the patient question will be, why you are not using dissolvable stitches? Because nowadays everywhere they are doing the stitches with the dissolvable stitches. Then we can answer like this. Your question is quite respectable, and I appreciate your question. I can tell you that your wound is deep, and if we are stitched with non-dissolvable stitches, it will be more secure. That's the reason doctor has stitched your wound with the non-dissolvable stitches. Are you getting my point? So that's fine. Then last, the task will be establish patient's willingness to return home. You can ask, I hope I have clarified all your doubts, Mr. James. Do you have any more concerns to get clarification? The answer will be no, it is okay, fine. I got every point. Thank you for information. Then we can tell, I'm once again reassuring you that no need to worry about anything of your wound. And I'm reassuring you that if you follow all my advices and take care of your wound, your problem will resolve soon and you will get a speedy recovery. Meanwhile, if you need any help or clarification, please do not hesitate to contact with us. Have a safe day. So that's enough. With that, we can conclude the role play.